In today's video, we're going to be demonstrating two very important instruments in what we do for dry eye care. The first instrument is called the BlephEx, and the second instrument is called the iLux-2. I'm Dr. Bryce Heffington, and we're going to be performing these procedures on Heather Heffington, also known as my mom. So let's begin. First thing we're going to do is we're going to get these little instrument devices out and prepared. But first things first, we're going to need to make sure that Heather's got her glasses off, tissue for when we put the numbing drops in, because we like to numb the patients up for just comfort measures at this point. So it's just a little Preparacaine 0.5%. And all I need you to do is lean your head back for me, look up to the ceiling as high as you can go. Just keep looking up right there for me. Good. You can kind of blink a couple of times and catch the little drops that run down your cheeks. While she's doing that, we're going to prepare the BlephEx tips. So how we prepare the BlephEx tips is that we get these two little devices out. They kind of look like Q-tips, and we soak them in this little disinfectant foam, or antibiotic foam in this case. And we're just going to kind of scrub the outside of the eyelids, removing the biofilm, as well as removing the hardened oil gland capped over portions of her meibomian glands. Just get a couple little spritzes there. And just let those sit for about 20 or 30 seconds or so. Heather's got some chronically dry eyes, but also a little condition known as EBMD, Epithelial Basement Membrane Dystrophy. This is kind of what happens when your corneal tissue regenerates too quickly, and there's holes, gaps, patches, and the eyes really don't feel that good, do they? How would you describe your eyes, Heather?
Burning, kind of just bruised, almost feeling dry and tired.
Yeah. Pretty common responses a lot of times for these patients, but this can really help you if you have dry eyes or anything affiliated to EBMD or watery eyes, gritty eyes, itchy eyes, stinging eyes, burning, light sensitive, watery, anything like that. So I'm going to step past you here, and we're going to get ready to do the first eye. So we always start with the right eye usually. We put the little Q-tip looking device into the little BlephEx, little instrument right here. And we're just going to start with the right lower eyelid. Ask you to step over here for me, Mark. Thank you. Ready for this, Heather?
Yeah.
Okay. Lean your head back in the chair. Look up to the ceiling as high as you can go. And what's going to happen is I'm just going to be pressing this little button here. You just keep looking up for me. Doing great, Mom. Just kind of scribble along the bottom eyelid here. See how we kind of just go back and forth as if we're kind of scribbling on a piece of paper? Great. That's all there is to it. Check out all the eyeliner we were able to just briefly get off or remove. Ready for eyelid number 2? All right, look down toward your toes for me. Keep looking down. So it just kind of skirts along the outside of the eyelids, the eyelid margin, removing some of the biofilm. Like going through a car wash for your eyes in a way. Check that out. All the makeup and eyeliner that we were able to remove.
Taking my makeup off too. Even more.
Even more.
That's about $400 in Maybelline.
So that's the first eye that's been completed.
I love that feeling. That one feels so much better already. It's real like clean.
It's like a teeth cleaning in a lot of ways.
Like I've got my one tooth clean. This one's clean, and this one feels like all gunky.
Yeah. This would be a good demonstration for people if we just do one eye, let them sit for a minute, and then wait to do the other eye.
This one feels refreshed.
Good. We like refreshed eyes. Ready for eye number 2?
Ready.
Okay. Once again, lean your head back. Look up as high as you can go for me. You just keep looking up. Removing all the caked up hardened oil and any crustiness, the biofilm, dead skin cells, anything around the eyelids that's causing any eye irritation, dryness issues. The nice thing about this instrument is that it goes both clockwise and counterclockwise. And when I press this little button, it just tells it which direction to go clockwise or counterclockwise. Now we'll do the last eyelid. So just look down toward your toes for me. You just keep looking down as best you can. Doing great, Mom. Another round of makeup, eyeliner removed.
Let me see.
Look at all that we just took off of you. But that is how we do the BlephEx. It takes about 2 to 3 minutes to perform, and the patients often feel like that their eyes just got a teeth cleaning in a lot of ways.
Feels good.
We like feeling good.
What was that one thing called that you
The biofilm?
Yeah, what is that?
It's just like a layer of bacteria, dead skin cells that are sitting on your eyelids, basically.
That's probably what it is.
Probably does. It's like removing plaque in your teeth, basically, in a lot of ways.
Somebody described it to me, it says like putting fresh windshield wipers on your car.
That would be yeah, that makes sense in many good ways. So now we're going to move to instrument number 2. This is known as the iLux 2. Was FDA approved, passed, and released to the market in this past spring. And it's been a huge blessing and an awesome benefit to help take care of a lot of dry eye patients and myself as well too. I've had both instruments done on me as well, and it's made a very big game-changing difference as far as my dry eyes go. Heather was actually one of the first patients that received both treatments, except we're doing it in a little bit of a different order. She had the oil device previously and then the lid scrubber. Now we're doing the lid scrubber and then the oil device in the proper sequence that we found to be most effective. So how this works, there's a little digital pop-up screen display that we're going to be able to look and see how we're lined up with her eyelids. But this little device here is going to kind of grab and heat up the eyelids to about 38 to 42 degrees Celsius, also known as 100 to 108 degrees Fahrenheit. You ready?
Ready.
Okay. Lean your head back for us. Look up to the ceiling as high as you can go. And we just kind of slip this into the lower eyelid right there. We kind of line that up. Grab the lid, and you can go ahead and close your eyes for me, Mom. So if you want to watch on the little display as she relaxes and her eyes have a little bit of a spa treatment, this device is heating up. That we're currently at 36 degrees Celsius. Do you feel it warming up, Heather? Okay, very good. And once it hits about 38 degrees Celsius or 100 degrees Fahrenheit, there's a little timer that starts. And we usually like to let this go for about 40 to 50 seconds to really melt all that juicy, hardened oil. It's like a candle wax consistency inside your eyelids. You're about 20 seconds in. You're doing great. And about 30 seconds in. And we're now at 40 seconds, so we're going to push all that nice oil to the surface with this little mini massager sequence. One more little push. Good. That's what it takes to do one eyelid. We just do that 3 more times, and that completes the entire procedure. How do you feel so far?
Good.
Good.
Nice and relaxing.
We like nice and
It's
relaxing.
warm.
We like warm, nice, relaxing, melting all that hardened oil to get it to the surface. Because we did this several months ago, but given your condition of EBMD, we're going to need to do this maybe a little bit more frequently for you, especially as we go into the winter months, furnaces firing up, things like that. Ready for number 2?
Ready.
Lean your head back, look down toward your toes this time. So we just invert the instrument, flip it upside down to catch that upper lid. Grab the upper lid, go ahead and close your eyes for us. And then we just let it do the same thing again, hold it in place. And 30 seconds in. And you're now 40 seconds in, so we're going to kind of push all that nice melted oil to the surface. Great.
Feels very wet.
Good. We like very wet. Once we get that oil back, it should start filling in some of those areas that your cornea is a little irritated on.
Did you see some stuff coming out?
No, it just looks like regular oil. We're just promoting more of the glands to open up. Because you had a couple of them that we're doing, but you need more doing them.
This one feels so much more wet.
Mm-hmm. That was the more irritated eye initially too when we were looking. Ready to keep going?
Ready?
Okay. Lean your head back, look up, tilt your head a little bit this way for us. Look up as high as you can go. Grab the lid, go ahead and close your eyes for us. Let's do the same thing, heating up the left lower eyelid meibomian glands. Does that feel okay for you?
Mm-hmm.
Okay. There's been some patients that have had this done that have had some hardened oil that's only come out like toothpaste, not like warm olive oil. So the more olive oil we can get, the better this is going to be. But if it comes out like toothpaste too, it's still going to help you feel really good.
Mm-hmm.
But we haven't seen toothpaste hit on you at all, Mom. And that's 40 seconds in, so now we are just going to push all that nice golden oil to the surface and really get things producing. There's a lot of good oil glands pushing to the surface right there. Get a picture of that. I'll get rid of that. Is that one a little forceful?
No.
It wasn't? Okay. There was a ton of good oil coming to the surface
Really?
on that one. Yes. Good olive oil too.
Nice. Will that promote more?
Mm-hmm. It'll promote a lot more. It was like, I can't think of the word for it right now.
Was it like loose?
Loose olive oil.
Was it like that when I had it done before, or this time better?
This time better, I'd say. Because you're already kind of opened up and loosened up for it. So we'll go ahead and snag the last eyelid. You got it. Just look down for me toward your toes this time. You okay?
Mm-hmm.
Just keep looking down as best you can. Good. Line that up. Good. Just like that. Now just keep your eyes closed. And your timer started. And 20 seconds in. Seconds. And that's 40 seconds now. So lastly, we're just going to push all that nice upper eyelid oil to the surface. Very good. If you like this video and this demonstration today, give it a thumbs up, subscribe to the channel, and tap the bell for notifications to stay up to date on the latest content we release. I'm Dr. Bryce Heffington, and we'll see you next time.